Okay, this is a presentation on nursing professional development, a transparent review of the options. I am Lori Berghoff. I am a seasoned nurse. I've been a nurse for over 35 years, and I am going to share with you some insight that we look at when we talk about a career nurse and what does that mean. I have been at the bedside for about 39 years. I do have my certification in cardiovascular and leadership. I did attend I did receive my DMP from Walden, where I studied staffing effectiveness related to a neighborhood staffing model. I've spent the last 12 years in different leadership roles supporting many different types of teams to achieve their goals. I have no disclosures at this time, and Dr. Dunn has no disclosures at this time. So let's talk about learning objectives. We're going to identify components of the professional development in the nursing field, including ongoing education, skill development, and networking. We're going to compare and contrast various nursing career paths, such as clinical specialization, nursing education, research, and leadership roles. We want to evaluate the benefits and challenges of obtaining these advanced nursing degrees, certifications, and licensure. We're going to recognize the importance of professional organizations, conferences, and networking events to promote personal career growth and staying current in the industrial trends. We also want to identify strategies for you to develop your own personal action plan for pursuing the professional development opportunities. So let's talk a little bit about professional development. We're going to look at definitions, components, and the importance, if it's really necessary or not for us to continue our professional development. When we think about professional development, we can define it as training or education to advance your skills or knowledge. This can be in the form of seminars, professional certificates, higher education courses, or just the basic mentorship program. Usually these programs are supported by your employer to invest in you, their employee. The goal of the employer is that your staff members' skills and knowledge evolve as the practice changes. Components of professional development. Let's talk about education. Education can be seen as advancing your career, taking classes, or going to professional conferences. The goal here is you learn new stuff and gain more knowledge. Skill development can also be a part of this professional component, and that is with learning new equipment, taking workshops, or communication. Remember that a skill is not just using your hands, it may be using your brain as you develop different things to work on in your environment. Networking. This is the one we always forget and have trouble with. This component includes meeting new people. And I'm not saying that you need to go out and meet somebody from California if you live on the East Coast or the West Coast, but maybe you go out and meet people within your hospital. Maybe you go out to other units, other hospitals within your cities, at different locations. I know that meeting people through at the hospital has been great because you get to see what their environment is without really going outside of your hospital. The other thing that I'm going to share is I remember when my first manager came and said, Lori, now that you're done with your degree and you've got a year of education, we're going to talk about your career plan and your professional development. And I'm like, oh no, I just got done with my nursing and nursing school is hard. I just want to be a nurse for a little while. And she was very kind and said, you know what? Okay, let's just see how things go, but talk to your peers and see what they remember about professional development and if they think there's things that you can do. So I did go out and talk to my peers and said, okay, guys, the manager, we'll call her CB, is talking about career development and I need to have a path. What do you guys know about all this? And the nurses are very kind and said, you know, Laura, you got to do more than just get out of nursing school. That nursing education only lasts for so long. As we develop and we progress, we change the way we do things. So you need to stay current and you need to stay above of what's going on. Whether you want to be a career bedside nurse or you want to do other things, you need to have a plan for it. So I'm like, okay, So then I started doing some research and thought, okay, what is a professional development plan anyway? But the data shows that the benefits of having a professional development plan improves employees' engagement. It increases nurses' retention, attracts top candidates, and improves productivity. The other things that I was learning when I was doing some research about professional practice is it actually improves patient care. The more we know, the more we expand our knowledge about nursing, the better we are to take care of our patients. So we're going to do a little assessment question here. First question, the components of professional development include which of the following? Education, advanced skills, networking, or all the above? The answer is all the above. Correct. Professional development includes education, advancing your skills, and networking. You can do all three of them, or you can only do one of them. But a career path, do I really need it? I just want to be a nurse. So let's talk about what nursing means. And are all nurses the same? We hear a lot of, well, a nurse is a nurse. But I think we need to take a little step back and look at and see where all the nurses are out there. Fun fact that there are 3.1 million nurses doing jobs in the United States, and that was in 2021. Places that nurses worked, hospitals, procedural units, physician offices, nursing and residential cares, those are your LTACs and your SNFs, government, the Peace Corps, United Nations, those are the ones that we may not see as much here, but we may have a Veterans Administration hospital in our location or close to us, or the CDC. We all know that the CDC is an area where we can work for the government, or there are educational services. So what is the responsibility and work environment? Let's talk about hospitals. We know that 60% of our nursing force works in a hospital. A hospital is 24 hours a day, 7 days a week. Care is usually related to what unit you work in. You're being assigned 4 to 5 patients if you're on a med-surg floor, or maybe if you're in a critical care or a specialty area, you only have 1 patient, but you are going to care for that patient to the best of your ability. Hospitals, like I said, have different levels of care. They have different areas of the hospital. Some of those areas include their OB department, critical care. Critical care is not just an ICU. They can be specialized critical cares like cardiovascular ICU, there can be a medical ICU, a surgical trauma ICU, but there can be multiple different types of ICUs in one health system. You have your surgical floors, you have your medical floors, you have pediatrics. All of those are things that you will find in the hospital, and the hospital is 24/7, so they never close their doors and they're always there to take care of patients. Procedural units. As the insurances and care changed, we moved a lot of our hospital procedures out to a procedural area. And the nurses that work in this area are about 18%, and they're going to care for patients with a single concern. They may be in the operating room, prep recovery, endoscopy, or interventional radiology. They're just going to be focused on that one patient and that one procedure. So if I'm in the operating room and my patient's going to have his gallbladder out, then I'm going to focus on bringing them in, getting their gallbladder out, and then I'm done with that patient. So my time with the patients are shorter and more specific. Physician offices, about 7%, and residency or CNS, SNFs or LTACs are about 6%. Both of these physician offices are not 24/7, so you're going to assist with the patient as the physician needs you to. You may be administering medications, you may be giving shots, you may be looking at immunization records. You might be a triage nurse that's answering phone calls. Different offices, physicians have different requirements for their nurses. Nursing and residential care facilities, this is your SNF and your long-term care. And those patients can be in those units for 20 days to up to 60 days, depending on what the care is needed. They're also a 24/7 responsibility. So they have patients that will be with them 24/7. So nurses can work nights or evenings if that's what works for their lifestyle. Government areas, they're about 6%. And government, you have to think of, can be a wide variety, but majority of them are monitoring, collecting data, following communities, looking at resources that they have. When you hear the Board of Health is here to validate a patient's concern, you know that they're looking at our accreditation. They also assist with care and immunizations in certain locations of their community. A lot of places have super shot Saturdays, where that's an immunization that they do for children within that community. Education, which is about 3%, can be anything from a school nurse to education with a hospital to professors. These can all be in private, local, or state areas. There's no one area that is defined that says education nurses work here. So what are their hours and training and experience? I may want to get into the VA system. What does that take? So when you think about hospitals and nursing facilities, they're 24/7. A VA health system may be 24/7 also. You require training and experience. Usually it's an ASN level. You have to have your nursing licensure. And then you will specialize based on whatever area of the hospital or facility that you want to work for. Procedural areas are usually Monday through Fridays. They might have a limited weekend. Majority of the time they are limited hours on the weekends. They do require a BSN, and they will train you with what the skill set they want you to have. Government, again, depending on the area, it could be a 24/7 or a Monday through Friday. When you think of 24/7, that is more of an acute care hospital or a long-term care hospital. Monday through Fridays may be your CDC, your Board of Health, your local health systems. Those are require at least a BSN to be able to work in those locations. Education is usually Monday through Friday because they are working within a school environment. And the school can be a school nurse, or it could be a professor at a university. School nurses require you to have your BSN. Then your professors, you can have your BSN, but they're wanting you to advance to your MSN to be able to teach at that professional level. Money, money, money. Who's making it and where's it going? When I did some research on this, I was surprised to see that the government programs actually paid more than the hospital, your state and local private areas. Government's about 85,000, hospitals are about 78,000, ambulatory settings are 76, nursing and residential care facilities are about 72, and education is about 61,000. The thing you need to remember about these numbers is these are just baseline salaries. It does not include overtime. It does not include the travel nurses that are out there. This is strictly if I'm going to come in and work 36 hours on a med surg floor, this is what I could get without any experience. The other thing you need to think about is the educational services. Those are based on usually a 6 to 9 month contract. You don't have the 12-month contract for certain nursing programs. So it's usually a 9 to 10-month contract. So when you think about that, their pay is not as bad as what it looks like on this screen, but it can be lower. So let's talk about beyond the bedside roles. Who's out there and what else can we do? So there are two roles that I want to talk a little bit about, and that's research and education. Research nurses. Who doesn't love a good research project? There are people that really love this kind of stuff, and there are people that are like, I don't know if I want to do that. But there is a place in the inpatient hospital areas that they are having nursing research being done. They have a nurse research coordinator who actually coordinates the research, and they're actually providing different types of research at the hospital level. Education, we all love our educators. And they can be done at the bedside. It can be done in classes. There are different ways in which educators help us within the environment. So how do they compare on hours and stuff like that? When you look at an educator or a research person, they are not going to have straight hours. They can be different every day. Every day they might have a different project to work on. Both of these areas or these titles can be found in labs, research centers, educational centers, and or hospital settings. Their hours, again, vary based on their projects. Pay usually aligns with the lower management level, which we talked about a little bit earlier. And entry level for a research or educational position requires a year or a BSN 4-year degree. Sometimes you have extra education based on if you're wanting to advance into your research, they may have you get a research certification or something different. Where else are nurses? Well, we know that their leadership is another role for nurses, and there are 3 different types of levels. There's a first line leader, there's a middle leader, and there's executive leaders. Most of our nurses are in the first 2 lines of leadership. The first line leader is your charge nurse, nurse leads that you have. It can be an operational lead, it can be a supervisor. These are nurses that actually help within the unit. They may make assignments, they may take patients, they may help admissions with whatever they need, but they have select things that they are going to do within that department. And their salary is about 78 to 80,000. This role can get overtime. So if they work extra, they are still considered an hourly employee. So they can make extra money if they want to stay over or they're doing something special that they would like to be involved in. Middle management is probably the hardest role of leadership. If you think about it, where it sits in this cascade, you have people from the bedside sharing and you have people above sharing. So sometimes this middle management can get a little bit stressful. Requirements usually is a BSN. At least some places will require managers or directors to have their master's in nursing. Salary is about 80,000 to 120, depending on their experience and where they're at. The executive level, which is we consider the C-suite, is where we have nurses that are sitting with the executives, maybe the president of the hospital, on different boards, and they're representing nurses within that environment. These can be titled anything from assistant executive to assistant CNO to CNO to a VP of nursing to a chief nursing exec. The requirement to be at this level is at least a BSN. Some places require you to have a doctorate. Some people want a BSN plus an MBA. You have to just think about where you want to be and what does that look like. Salary is anywhere from 100,000 to 200,000, can be more depending on where you are working and what your cost of living is. So what does it take to do these types of roles? We know that entry level is a BSN or an ASN. If I want to be a charge nurse or a nurse leader, I might have to get my bachelor's if I have an ASN. Master's if I want to do more than just be at the bedside. And I shouldn't say more than just, we need nurses everywhere. So you being at the bedside is just as important as me being in the classroom. But my requirements are going to be a little bit different. I might need my master's, I may need my doctoral. If you would have told me 20 years ago, I'd be sitting with my doctorate in nursing and teaching in the clinical setting, I would have told you you're crazy. Never had a plan to get my doctorate. It was just something that worked out for me. It was fun to be able to see and my education advancing. It also was fun to be able to meet people from other locations and talk about things that they were doing in their world. What are the other areas of advanced nursing? So we know that there are other types of nurses out there and they're called APPs. And these are advanced nurses that have advanced degrees. And they can be nurse practitioners, nurse educators, clinical nurse specialists, nurse anesthetists, psychiatric nursing practitioners, or midwives. So you think about it, you can see any of these within the healthcare environment. Each one has a special different course. So what's the benefit of getting an advanced degree? It sounds to me like it's a lot of work. The benefits of it are you're going to get a higher paying position and you have greater responsibility. It's a personal fulfillment that you want to do. There are more job opportunities. You become the expert in that environment. If I decide to be a nurse practitioner and I want to focus on cardiology, then my expert area would be cardiology. You also get to expand your professional networks, places where you can meet other nurse practitioners that are doing things is always great because you're able to expand that. And that professional network that we talked a little bit about with your professional developments, that is part of that. Challenges, we have to remember the cost of these programs are high. It isn't at a graduate level. So the expectations is it's high. It's many different types of programs. You have to really decide where I want to be. Do I want to take care of kids? Do I want to take care of adults? Do I want to take care of OB patients? Maybe I want to be a midwife. Well, maybe I want to be a CNS. You really have to decide where you want to be and where you want to go. Overall, the programs are very tough. They're very advanced and they expect a lot from their students that are in it. They're very time consuming, meaning that they include clinical hours. So when you talk about getting into a program, you need to look at what the clinical hours are. When I got my master's, my one class needed 240 hours of clinical. And I thought, oh my lands, how are we going to do all this? And you just have to figure out what works and what doesn't work. But you have to remember, if you're going to go into an advanced degree program, there are going to be clinical hours that you are going to have to figure out how to work. Some programs you become totally submersed in that environment and you don't work at the same time. You're only going to school for 2.5 to 3 years. So different programs have different commitments. So you're going to just look at that and make sure the whatever you get into works the best for you. What does all this mean? When I hear advanced practice providers, it just sounds like they have initials, APPs. Everybody talks about APPs. All an APP is that the nurse with advanced degrees and skills. They've usually have their master's in nursing and they become more specialized. So if I want to work in the area of nursing education, I got my master's in nursing education. I can work at universities. I can work in the hospital setting. I can work anywhere I want. There's a lot of online programs now for nursing education, but I started with my master's in nursing. A clinical nurse specialist also starts with their master's in nursing, but they become more rigorous in learning how to define best practice and doing best practice. And their roles within the healthcare setting is working with the people within the units and making sure the units are following best practices. Some places allow their CNSs to have advanced skill level. They have to be privileged just like your nurse practitioner, but they can do that. One example is we have a CNS that works in a hospital locally that is allowed to put different types of devices in. She's advanced skill set of putting suprapubic catheters back in if they get pulled out. So that's one thing that she can help with. So different CNSs have different roles within that healthcare environment. Certified nurse anesthetist is just what it comes with. You are working hand in hand with an anesthesiologist, working in a procedural area. You may be doing blocks. You may be doing total anesthesia, but it's between you and that anesthesiologist. A certified nurse midwife is somebody that works along with OB. Majority of these have their own clientele. In other words, patients that want to have a natural birth and don't want a lot of medications and stuff and are low risk may see the nurse midwife instead of the OB doctor, depending on what they want. But there is that option. Nurse practitioners are ones that we're going to see more and more of. They can practice and care for patients independently. This is very state directed. Their licensure with their practice privileges and DEA license is also state dependent. So if you are thinking you want to be a nurse practitioner, great. If you want to be in a certain location, you need to think about and do some research on what does that mean to be in that location with that type of license. Where do these people work? Majority of the NPs are seen in different provider specialty areas. Usually, you might see them in the acute care setting or in a doctor's office. Acute care settings, they can work with the hospitalist. They can work in critical care under the intensivist. We have seen NPs become specialized in cardiology, cardiovascular surgery. We also are seeing NPs becoming specialized in trauma and trauma care. Women's and Children's have NPs, and they also have certified midwives. Those are specializing in only women's health and children's health. So when they go to school, they will pick, I want to be a midwife, so I'm only going to be educated on women's health, or I want to be a pediatric nurse practitioner, so I'm only going to focus on the nursing of that type of patient population. Nurse anesthetists, as I said, are going to work right alongside the anesthesiologist. There are some areas within the United States that a nurse anesthetist can work independently of a anesthesiologist, but majority of them are under the umbrella of the anesthesiologist. So they may be found more in a procedural unit. We might have them in a birthing unit putting epidurals in. They might be in the orthopedic area putting blocks in, so they can be found in different locations. Pay for this type of advanced degree can be different depending on where you work, what state you work in, and whether you're charging individually for your services. Some places have the NPs are charged underneath the physician, so they don't have their own independent charge, which makes them actually receive less money. But it's something they work out when they decide their salary. Salary anywhere for this type of degree can be from 67,000 to 151 and plus. Again, it's based on what services they can provide for and what services they can actually bill for. So I don't want to go to school again and get an advanced degree. I really don't know if I want to, where I want to be. And when I had my conversation with my boss a long time ago, she said, you know, there's other ways that you can gain knowledge and learn about nursing. You don't have to go back to school. Maybe you get your certification or you join a conference. And I remember looking at her thinking, well, what in devil is a certification? And a certification is just where I choose to be certified in a certain area. There are two main centers or groups that actually support certification, and that's the American Nursing Credentialing Center, or ANCC. You may also know this as the Magnet Center. They will do magnet verification. They have over 50 certification specialties for different types of nursing. It can be surgery, it can be medical, it could be pediatrics, it may be holistic nursing, but there are lots of different specialties out there. There's also the American Critical Care Nurse Association. They have over 15 different certifications to support different forms of critical care. And we have to remember, critical care nursing is just not the adult nurse. We have NICU nurses, we have pediatric nurses. We have OR nurses that are considered critical care nurses. So there's lots of different types of certification out there. But why do I really want to get a certification, and what is it going to benefit me for? Well, you think about the benefits of getting your certification. It's going to enhance your professional credibility. You've taken that extra step and got certified. It validates my skills. It validates my knowledge. It helps give me that clinical competence that I need. The biggest thing I think certification does for nurses is it gives you confidence and expands your skill set. You become more confident as a nurse when you get your certification because you feel like you just validated, yes, I do know what I'm doing, and I feel like I know, and now I got my certification that says you do know what you're doing. You're rocking it. You're doing great. All of this can lead to higher salaries. There's not a lot of places that give extra money for certification. There's some places that do. So if this is something you want to look at, talk to your manager or your leader and say, hey, what does it look like if I get my certification? The thing you have to remember with certification is you have to have so many years of experience before you can set for it. So a med-surg certification, you have to have 2 years of med-surg nursing before you can actually take that. So just make sure when you're developing your master plan of how you want to do your professional growth that you add into that. Assessment question: why would obtaining a nursing certification help me better care for my patients? A, I can make more money. B, it allows me to advance my career. C, I increase my knowledge when taking a certification exam, which helps me to care for my patients better. D, bragging rights. Correct. The answer is C. You increase your knowledge by taking your certification, which in turn helps you care for your patients better. Great job. So I can't do certification because I'm a new nurse. I really don't want to go back to school. That stuff, I'm just burnt out of going to school. What else can I do that would enhance my knowledge and allow me to grow my nursing knowledge and my skill set? There are many organizations nationally or professionally within the world that specialize in different types of nursing. Fun fact that every type of specialty nursing has a professional organization that has education updates and different ways to improve your skills. When you think of nursing professional groups, there are lots of them. There are at least 40 national nursing organizations and 83 professional nursing specialty organizations. The difference between national and professional: national is worldwide. Professional focuses on a specialty. So I want to focus on critical care. So when I was about that year, 18 months out of nursing school, when my boss talked to me about this, I went ahead and joined the critical care nurses because I loved critical care and I was going to be a critical care nurse forever. And so that was the way for me to start developing my knowledge base. They sent magazines. I had online access to their website. I could look at all kinds of things that would help me look at advancing my career. That professional association focuses on research, education, and promotes continuing development for those nurses in that area. So they specifically go for a type of patient population. If you look at the national organizations, these are more national. They are more global. They're not looking at specific types of nursing. They're looking at nursing as a whole. The American Nurse Association is one of those that is on there. And the American Nurse Association was actually developed back in the late 1800s, early 1900s. And I was amazed by that, that nurses back in that time knew that we needed to be standardized and we needed to make sure that we all had the right knowledge and the right skill set to care for our patients. So if you ever want something just fun facts looking, go under the American Nurses Association and look at their history. They have done a lot in the last over 100 years to move nursing to where it is today. But that national organization allows you to look at things globally versus your professional association looks at things on a professional level. Benefits to joining an organization: well, I don't have to go back to school. And I don't have to have 2 years of nursing under my belt, but it will give me professional skill set. It will improve my patient's quality of care because I'll start to learn more about things. It shares best practice. It provides networking. There's always blobs out there that you can get on. Social media has a lot of different types of networking you can do. It provides nurses with various backgrounds, visibility, and resources. So it'll allow me to find out what they're doing in other areas of the United States. It advocates for the members of their organization, and they have lots of activities online to keep nurses informed and accountable. I think that's the one cool thing about the world we live in now. A lot of technology allows us to stay current, and active without ever leaving our house. Your specialty organizations were actually developed based on the demands of the healthcare environment. They wanted nurses to be able to pursue certification in a patient population. So that stemmed from looking at globally, and now as you looked at it globally, now you're going to look at it more as a specific specialty, so patient population. So I really liked the cardiovascular patients. So those are the patients that I wanted to get my certification in. The specialty organizations also have a lot of in-demand education that helps you stay up to date with challenges and changes in their specialty. They always have something on there that's new. I would encourage everybody, just go out and whatever specialty you're in, look at their website, type in the ANCC and see what's out there. You don't have to join. You can just peruse it to see what's available. But if you are going to do a organization, find one that works for you. I have a lot of nurses that are in the holistic world now, and they network really hard in holistic nursing. And there's a certification for holistic nursing, which I don't think 10 years ago we would have had one available. So it's always changing. Now let's talk about developing your personal plan. Oh my goodness, where do you start? If I look at this picture, it shows me roadmaps and it has everything intertwined. And that's kind of where we come from. We all come from different levels and different ways, but let's talk about where you want to be. Where do you want to be in your career? You just finished nursing, or you've been in nursing for a long time and you want to do something different. Let's talk about it. Write it down. I think I want to get certified in critical care. Okay, great. Let's make a plan and figure out how to do that. Maybe you want to go back and get your degree. Maybe you want to be an advanced practitioner. You love working with the providers and want to work hand in hand with them. Maybe you want to be a leader. But maybe you want to do all of these. There's no reason you can't do all of these. Advanced practice nurses can also be leaders. So there's not one way that you have to do it, but we have to define where your love is. Where's your passion? You got into nursing because you like to take care of people. Now, really, what type of people make you smile and fill your cup? Okay, so now we're going to talk about developing your personal plan. And the key word in this is my personal plan. What do I want to do? Where do I want to go? I think back to when I was first a nurse and I was in my what I call my idealistic state. I wanted to save the world. I wanted to save the world and fix everything. But I knew from my personal plan that I couldn't change what was happening in certain parts of the world. So then I had to start and think about, where do I want to be and what do I want to do? Where's my passion? Yes, my passion is for nursing, but is there a particular type of nursing that I want to do? Is there something that I wanted to do differently? Where could I go and support and change the world for that type of nursing? So when you assess your goals, maybe you want to get your certification. Great. Maybe you want to advance your degrees and be an advanced practice nurse. Great. Maybe you want to do leadership. Wonderful. But what happens if you want to do it all? You can. There's no reason that we say nurses can only be certified in this location. You can only be certified in this specialty or this specialty. There's no rule that says we can only do one thing. Maybe I want to get my certification in critical care. I'm going to go back to school and get my advanced degree, and I want to practice as a CNS in critical care. Great. But you know what? I kind of like leadership too. So maybe I want to do a little bit of all of it. You can. There's no rule that you're not a leader if you don't have the title. So think about it. If I did my certification in critical care and I went back to be advanced practitioner and I want to be a CNS, do you not think that that is a form of leadership? So really, I've accomplished all those goals that I had right there in what I'm wanting to do. Opportunities, where do I start? Well, there's lots of opportunities as we've talked in this presentation about online stuff. Listen to podcasts. There's a lot of them out there that talk about nursing that are very good. Review your specialty website. Take opportunities to free online education if you see it. Shadow a person working in a job you think you want to do. If you want to be a nurse anesthetist, let's go find a nurse anesthetist for you so you can shadow them to see, is this really where I want to be or not? Because I don't know if this is really what I like to do. Or you can get in it and think, oh, this is really cool. I am so excited. I know what I want to do now. You won't know until you go out and start looking and ask questions, look for knowledge, look for guidance. There's people that are been in their careers for a little bit longer than you have. Gain knowledge from them. Your growth is only going to come within you as you advance your skill set or knowledge. Take advantage of what's offering in your unit. If they have a in-service for something, listen to it. Talk to your leaders about where you want to be. I really want to be a charge nurse or nurse leader. Talk to your nurse leader about how can you get there? What do I need to change for me? What is good? What is bad? You know, I know when I became a nurse leader, my manager sent me down and said, you know, Lori, we know that you can be a little boisterous at times, and you need to be able to think about what you're saying at the moment. So I had to learn some emotional intelligence. I had to think about things that set me off. And then when I was in that leadership role, I had to remember to tuck that in the back of my mind and not let it ruin my day, or I don't want to hurt anybody's feelings with the things I said. One example of this is I had a manager who always came out every morning. Well, I hope you guys got your skates on because it's going to be a bad day. Well, when somebody tells you that, you already think, oh my, it's going to be a bad day. So what you need to do is find out from your peers and your managers, what do I need to do to be able to be this professional that I want to get to? What opportunities do I take? What can I do if I don't want to go back to school right away, or I want to, I really just don't know where I want to land. What does it look like? Take advantage of the things that are happening in your unit. Learn new skills, new patient volume. They say there's going to be this new type of patient volume coming to your department. Hey, you know what? I want to learn about it. I'll champion that for you. Do things like that that will allow you to grow, even though you're not going back to school or getting your certification. Listen to podcasts. There are so many different forms of podcasts out there that have lots of great information. Like I said in the previous slides, look at your specialty websites. What does that look like? Is there something that you can learn from there? Do their online education. Take opportunities for any time you see free online education. I know some places require you to have CEs with your licensure and some of them don't. So if you see that online education and it's free, even though you don't need CEs, take it. It's a way to increase your knowledge and your skill set. Shadow people that you think you want to do. So I want to be a CNS. I'm going to shadow one of the CNSs to see really what they do during their day. Maybe I want to be a research nurse. And so I'm going to go talk to the research team and say, hey, can I come spend some time with you guys on research? Because there's nothing wrong with investigating and gaining knowledge and trying to decide where I need to be next. If you shadow somebody and you think, oh, my lands, that is not where I want it to be, then it's great, because then you don't have to do that. Now you can focus on something else. Ask questions when you're looking for knowledge or guidance. Ask questions for anybody. If you're wondering what people think about nurse practitioners in the workforce, ask people, see what you can do. I had to whittle down what I was doing from saving the world to saving patients with cardiovascular disease to working with the nurses at the bedside in my leadership roles so they had what they need. So my career goals was to save the world, but I had to do it in bits and pieces. So you have to just remember you have this opportunity to do lots of things in different ways. There's no one path, but you get to set the path that you want. Strategies for networking. Networking can be something that can be really fun, but it can be very intimidating to a lot of people. A lot of people don't like to network. They would prefer to stay in their own environment. But networking is really something you're going to do that's going to help bring your profession and your career farther. You do not have to start with a big organization. You can start small. Join your hospital shared governance program. Join an organization and review their websites. Develop a research club similar to a book club. You guys can do research articles and talk about what's out there and what's going on and what makes things exciting for you. You do not have to join someplace else or a big network. Funny thing about networking, I was at a conference at one time, and there was a speed networking, and I thought it would be really fun, and I was trying to get my friends who are with me to do it, and they're like, oh my gosh, no, we're not going to do this. And I said, it's like the same thing as speed dating. It's just going to be speed networking. We're going to talk to each other for a few minutes and we go on to a different table. So they had it set up in a round circle, and you had people on both sides of the table, and you were allowed to talk to them about where you're from, what your career was, what is the best thing about your department. And so you got to learn a little bit about different people in a short amount of time. I thought it was really cool, and what a great way to get us to laugh and to think about things and not worry about, am I networking the right way? Because I think that we get tripped up in that networking word, and I don't think you need to make it big or alarming. I think you need to just learn that you're just talking to people outside of your own department. Strategies of networking. And when you think of networking, you think, oh my gosh, do I really have to talk to somebody? Some of us, including myself, are very much introverts, and we only become extroverts when we go out and talk to people because it fills our cups. So you have to think about, what does it mean to network? When you think about networking, it sounds like this big, I got to go to this big organization and I got to meet all these people and I need to find people from different locations so I can be friends with. And networking can be as small as working with your hospital in their shared governance. If you have a hospital shared governance program, get involved with that. That allows you to see what other nurses are doing within your own organization, and you become friends and say, wait, how did you guys get to that when we've done this? So you're sharing, and that is a form of networking. So it doesn't have to be large to be networking. It can be very small. You can take a online class and network with the people that you work with or meet in this class. A lot of people, networking comes from, they decide to advance their degree and they go back to school to get their bachelor's or their master's. And they're within a environment where they're meeting people from other organizations and other times, and you're always put in a cohort so you can get to know people from outside of your organization. That is a form of networking. So networking doesn't have to be this great big monster that you have to take on. I think of one time when I went to a conference with some peers. They had a program at the end called speed networking, and I thought, oh, that will be interesting to see what that looks like. And it was on the form of speed dating, so we all know what speed dating is. And you had 5 minutes with the person sitting across from you to talk about yourself and where you were from and the type of facility you worked at and whatever else you wanted to share. And it was a great way for us to get to know people from outside of our organization. The funny part was, my peers that I was with, who I think are always outgoing and want to talk to everybody, did not want to do the speed networking, which I thought was kind of funny. But I did it. I met some great people. I still have some contacts from other places in the United States that I know I can text them or email them and say, hey, this is what we're working on. What are you guys working on over there? So don't think of networking as I have to do it. Think of it something that I get to do. What does it look like if I want to do this? This is going to be something that, may be down the road. You may end up moving closer to that location and you want to talk to that nurse about what is it like to work in, I'm looking at this hospital. What do you guys know about it? There's nothing more important than having that network that says, ooh, if you're going to work there, these are the things you need to work on. So when you think about networking, don't thinking of it as a big monster. Think of it as small. What can I do within my hospital, my shared governance, when I float from unit to unit, when they're handing off patients, when you get the patient from the ER, talk to that ER nurse. When you get the patient from the OR, talk to them. That's networking. You're meeting people outside of your normal environment and you're putting yourself out there to get to know what their world looks like. We all know within the hospital that different worlds look differently. OR is different than ICU. ER is different than med surg. We know that that's the way it's supposed to be. So, reach out and make friends in other places. You can also join the organizational websites. There's always ways to connect on websites with social media nowadays. The technology is phenomenal. We all know that technology and websites can be a positive or a negative. And, I tend to look at them as a positive. It allows different organizations to share different things. You can join an organization based on your specialty. So I wanted to join an organization on a social media platform that looked at leadership, and they had opportunities to share different things. One organization has a leader to leader discussion, and you post things that you want to know and you get to meet leaders from other organizations. Something small that you could do if you want to improve your networking is to develop a research club with your peers on your unit. We get to know the people we work with on our shift, but we don't get to know much of the people that we work with on other shifts. So maybe you do something similar to a research club, which is a book club, but instead of a book you're reading, you might just come up with an article and send it to everybody and say, hey, let's have this discussion about this article. And you could do it online that you guys all just post with each other and share the information that you want to share based on that article. So again, this is all forms of networking. And it's all ways of you meeting new people, advancing your career, looking at your knowledge, and trying to make yourself be more aware of the things that are around you. So goals, your pathway, your way. And the reason I say this is because you get to decide where you want to go. After I had talked to my manager back several years ago, and she said I needed to think about where I wanted to be, she kept telling me, go back to school, you've got this, you're going to be really good at going back to school and you're going to be a great nurse. And I thought, oh my, I just don't know about this. I'm from the era that you just get married and have kids and live happily ever after. And, she kept talking to me as time went on. And as I worked in the unit year after year, I realized there are things that I could do to make my career better. And so I did end up going back to school. I got my bachelor's, and then a couple of years later I went and got my master's, and then I got my doctorate. But it was all done on my way and on my path. What I learned during this time is you don't have to have big wild goals. You can just have little goals. I use the SMART goal setting for me because it helps me define it, make sure I know what I'm looking for and where I'm going. So if you want to use a SMART goal process, do that. The S is specific, measurable, achievable, realistic, and timed bound. So when I think of SMART goals and I think of realistic, I always wanted to be on Star Trek. I always wanted to go into the beyond our galaxy and fly away. And I knew that I was never going to be an astronaut. So me making a goal that I was going to be an astronaut was probably not realistic. So you have to make sure that you make them part of your career path. I did mine and made them short term and long term. So my short term, I wanted to accomplish between 6 and 9 months. And I looked at how do I accomplish that? And then my long term are the things, where do I want to be in 5 years? What do I want to do in 5 years? And I know if anybody has done any interviewing, that's a question they always ask. Where do you want to be in 3 years? Where do you want to be in 5 years? Think about when you're making your path, do it your way and set it out to be your goals and what you want to do. So with the conclusion, I want to share a couple tidbits that I have learned over the years, that professional development can come in many different ways and many different avenues. No path is the same. Everybody's individualized. I know that it takes a lot for people to advance their careers. It takes a lot of energy, a lot of help trying to get them where they need to go. So find your cheerleaders, find your support system, share your ideas, ask them how they got to where they need to go. The cool thing about nursing and your career path is there's no mistakes. If I get down a path and think, ooh, I don't know if I want to do this, then turn around and do something different. Your education or your career advancement, there's no reason if I do my certification in critical care, if I want to be an OB nurse, that's not going to say, well, you can only do critical care because you have certification in critical care. You can get a certification OB. There's no mistakes in your development. There's going to be no mistakes in your professional career. You can do anything that you want to do. Explore any ideas. I think that's the greatest thing about nursing, is the endless possibilities of new roles and new advancements are out there. I think of my career of the 39 years, like I said, my first 20 years were in ICU. And then some things happened in my personal life and I thought, oh, I need something totally different. So I went to home health care. Who would have thought an ICU nurse would have went to home health care? That is craziness. But I loved it. I loved the idea of doing something totally different. Then after I was doing that for about 3 or 4 years, one of the physicians contacted me and they were doing a quality program in the hospital and wanted me to come in and work for them. And it's that physician that you never can really say no to. So you're like, okay, I'll come in and see what you're doing. And this role led me to be working more hand in hand with the cardiovascular patients. I got to do what they call a cardiovascular coordinator role, and it allowed me to work with patients pre-surgery, right, post-op surgery, and then when they went home. And our goal was to improve the quality metrics of that. And we did a great job. We did really good at making sure that we checked all the boxes for our patients and did everything they need to do. That role taught me a lot about seeing the patient's version of life. So as we think about the greatest thing about nurses is doing whatever you want to do, we also have to remember we still have the patients at our focus. Anything you want to do to advance your career or your professionalism, the patient is always going to benefit. So the one great thing about our endless opportunities and new roles for our advancement is our patients always benefit from everything we do. So here's your chance, make a plan, and let's get started.